My jaw clicks, my jaw pops, my jaw makes noise. Is that really anything that I need to be concerned about? You know what? Popping and clicking is very common. We see that a lot in our patients. Common, yes, but not normal. Let's talk about the pop. What's a pop? You know, what is it that I hear when I open my jaw or when I'm chewing? What is that pop? I'm going to demonstrate this. We'll look at this model, and when we look at this right here is our upper skull or our maxilla, and this is our jaw joint. In between the bottom bone or the mandible and the top bone is a little piece of cartilage. This is normal movement. When we open, initially our jaw rotates. As we open more, our jaw will advance and ride on the cartilage. We then go back, our teeth come together and the cartilage stays and remains between the top bone and the bottom bone. So what is it that determines that the jaw is going to take this position? Well, what determines is the way our teeth fit together. Our teeth dictate the position of the jaw. That's the whole purpose that our teeth come together, is because the teeth need to occlude or interdigitate with each other for effective chewing. That in turn has got to be coordinated with the joint. So what if my jaw develops, my teeth develop in such a way that my jaws tends to sit in a more back position? Well, what can happen then is it falls behind the disc, and the disc will actually pop forward of the bone. So when the person opens, what they will experience is I open and then click, I click on, I close and it comes off. I open and pop, it clicks on, and then I close and it comes off of the joint. So really, when you hear that pop, when you hear that noise, what you're hearing is a dislocated disc that is captured when you open as your jaw moves forward. So, is it normal? No, it's not normal. Is it common? Yes, it is common. So when do you treat it? When do you worry about it? I like to use what I call PDQ. The P stands for pain. If you're having pain, if you're having issues in your joint, you need to get treated. So pain is certainly one of the reasons. What about D? Dysfunction. What if you have a dysfunction where I can't open, I'm having difficulty opening my mouth to bite a sandwich or a hamburger, I have to squeeze it together because my jaw gets stuck? Then that would be a dysfunction. Some people will come in and they have to wiggle their jaw around in order to get their jaw to open. Well, that's a dysfunction. That's a point when you should treat it. What about Q? What if it affects, what's Q? Quality of life. What do you mean quality of life? Well, I've seen patients that they open, they hear pop, and they get embarrassed, they don't like it. And people look at them every time they open their mouth, or maybe even when they're talking, they feel very self-conscious of it. Well, that would be an instance where maybe quality of life, maybe it's making them uncomfortable. Well, then you can treat it. Can we treat it? Yeah, we can treat it here in the dental office. There's different things that we can do. Our goal is to get the jaw to rest on the disc as it normally should. There might be one other time that I would consider fixing that pop and click. This would be especially in younger patients. Let's say their bite's going to change. Maybe they're going to go into orthodontics. Well, if they have a pop and a click, it's a good thing to treat it before you go into orthodontics. So that would be an instance. Or for example, if we do what we call full rehabilitation, where we're going to change a bite with crowns and additions that we do to teeth, that might be another reason to address the clicking and the popping. So once again, if you notice that, let us check it for you. Let us explain what's going on and know that it can be checked, it can be controlled. Thank you.